Good afternoon, everyone. Wynn Brown here with Heywood Healthcare's update for the week ending Friday, September 3rd, as we head into the long weekend. We are very busy on both campuses and in our practices and at our urgent care. We have a surge of COVID-19 going on, which is stressing our resources and really putting a heavy burden on our staff, who know that that's what they're there for, is to take care of everyone. But please know it's a big lift for us, and I'm going to talk a little bit about that. As we go into the long weekend, I know that not just staff see this, but a lot of the community see it, and we really need everyone to push forward to get those who are not vaccinated, because the surge that we're experiencing is largely preventable. There are different stages of the COVID-19 infection, and a number of them are in our ICU, so I'll talk about that. I've been asked to share and read to you, to also be embedded in the email, an op-ed piece done called The 7 Stages of Severe COVID-19, which ran in the LA Times. And so while this is for our staff who aren't vaccinated, and our staff who work on the units actually know that this is almost 100% spot on. I think for the community, it's good for you to hear if you are not vaccinated or you have influence over people who aren't vaccinated and can get them to get vaccinated. This will help you a little bit. So stage 1, you've had debilitating symptoms for a few days, but now it's hard to breathe and you come to the emergency room. Your oxygen saturation levels tell us you need help, a supplemental flow of 1 to 4 liters of oxygen per minute. We admit you and start on antiviral steroids, anticoagulants, or monoclonal antibodies. You'll spend several days in the hospital feeling run down, but if we can wean you off oxygen, you'll get discharged and you'll survive. Stage 2, it becomes harder and harder for you to breathe, kind of like drowning. Many patients describe this feeling. The bronchodilator treatment we give you provide little relief. Your oxygen requirements increase significantly from 4 liters to 15 liters to 40 liters per minute. Little things like relieving yourself or sitting up in bed become too difficult for you to do on your own. Your oxygen saturation rapidly declines when you move about. We transfer you to the intensive care unit. Stage 3, you're exhausted from hyperventilating to satisfy your body's demand for air. We put you on non-invasive positive pressure ventilation, a big bulky face mask that must be Velcroed tightly around your face so the machine can efficiently push pressure into your lungs to pop them open so you get enough of the oxygen it delivers. Stage 4, your breathing becomes more labored. We can tell you're severely fatigued. An arterial blood draw confirms that the oxygen content in your blood is critically low. We prepare to intubate you. If you're able to and there's time, we suggest that you call your loved ones. This might be the last time they will hear your voice. We connect you to the ventilator. You're sedated and paralyzed, fed through a feeding tube, hooked up to a Foley catheter and a rectal tube. We turn your limp body regularly so you don't develop pressure ulcers, bed sores. We bathe you and keep you clean. We flip you on your stomach to allow for better oxygenation. We try experimental therapeutics. How ironic, I'm just editorializing here, that the majority of the patients who end up in our ICU and are critically ill are not vaccinated, partially because they believe that the COVID-19 vaccines are experimental. But we're going to use experimental drugs to try to save your life. Point I hope many people take. Stage 5, some patients survive stage 4. Unfortunately, your oxygen levels and overall condition have not improved after several days on the ventilator. Your COVID-infested lungs need assistance and time to heal, something that the ECMO machine, which bypasses your lungs and oxygenates your bloods, can provide. But alas, our community hospital doesn't have this capability. If you're stable enough, we'll get you transferred to another hospital for therapy. Otherwise, we'll continue treating you as best we can. We're understaffed and overwhelmed, but we'll always give you the best care we can. Stage 6, the pressure required to open your lungs is so high that air can leak into your chest cavity, so we insert tubes to clear it out. Your kidneys fail to filter the byproducts from the drugs we continuously give you. Despite diuretics, your entire body swells from fluid retention, and you require dialysis to help you with your renal function. We don't have dialysis at Heywood Hospital. The long hospital stay and your depressed immune system make you susceptible to infections. A chest x-ray shows fluid accumulating in your lung sacs. A blood clot may show up too. We can't prevent these complications at this point. We treat them as they present. If your blood pressure drops critically, we will administer vasopressors to bring it up, but your heart may stop anyway. After several rounds of CPR, we'll get your pulse and circulation back, but soon your family will need to make a difficult decision. Stage 7, the last stage. After several meetings with palliative care team, your family decides to withdraw care. We extubate you, turning off the breathing machinery. We set up a final FaceTime call with your loved ones. As we work in the room, we hear crying and loving goodbyes. We cry too, and we hold your hand until your last natural breath. So that's what happens with COVID-19. That's what we see in our ICU every day. And our ICU is actually full. Well, it's at 5 as of this report. All are intubated. So we have 5 intubated patients on our ICU. We have 3 COVID patients on Watkins, 1, and we have 1 rule out that we are waiting for the test results. So we have 8 total positive COVID patients at Heywood. And so that's just a huge demand on our staff when the hospital is also already full. And we are stressed to have enough equipment to care for everyone as well. Yesterday, across the state, there were 99 intubated patients in ICUs across the Commonwealth. That means 5% of the intubated patients were in Gardner. So in Gardner, we shot up from 16.9 to nearly 29.5 per 100,000 COVID positive patients. So 3 times what's considered the containment level. And so due to this positivity, we are restricting visitors once again on the Heywood Hospital campus and fully screening on the Athol campus. So it's real, it's important, and our staffing is stretched and exhausted. We're going to do the best we can. We had a major situation earlier this week where there was a mechanical failure of the oxygen system at our sister hospital, Health Alliance, just down the street, and they went on what's called Code Black, which means they fully diverted all their patients to us, which our ER stood up and did what we had to do, and we admitted 15 patients in very short order while discharging 10. So if you work in healthcare, you actually know what a heavy lift that is. So our visitation protocol on the Heywood campus, no visitors except for necessary visitation. So for end-of-life care, caregivers for those with cognitive and/or physical delays, legal representatives, and one parent of a minor. In the maternity department, only 1 person can be with you. That's your labor partner. And staff protocol, staff must wear, as always, a mask, foam in and foam out upon entering and exiting. And for anybody coming to the hospital campus, cloth masks are not allowed at this time. So we'll give you a fresh mask at the door if you are cleared to enter the hospital. At Athol Hospital, just a reminder that the Athol cafeteria will be closed on September 9th. That a memo went out with full details to staff yesterday. Don't worry, food will be provided in the Hillis boardroom all day, so everybody will get nourished. So please, as we enter into this celebratory holiday weekend, if you aren't vaccinated, make an appointment to get vaccinated. You can do it at any pharmacy and also through our primary cares and our urgent cares as well. But it really needs to be scheduled because we really don't want to waste vaccines when we open a new vial. So it's important that you give us a heads up on that, or just make an appointment online at CVS or Walgreens and you can get that done very easily. And if you are an influencer over the younger population who is not yet vaccinated, I encourage you to do that. Share this video and let them know that it needs to get done because we need to get to an immunity level, a herd immunity level that keeps this at bay so that this is our last surge. The state epidemiologist believes we have 2 more weeks until we actually peak in this surge. So we are not out of the woods. We have a long way to go. We're in a holiday weekend, and we need all of your support to be your community hospital as we continue our journey to be one of the best community hospitals in America. Take care and have a great weekend.